So insulin resistance really starts in the muscle, the skeletal muscle, the liver, and then goes to the adipose. Now, some people think that the real fundamental start is in the hypothalamus in the brain because of heightened inflammation in the brain. And then the hypothalamus controls your hunger and satiety signals. When the hypothalamus is dysfunctional, you start to eat too much, et cetera, et cetera. There's a variety of theories right now, but basically you will become insulin resistant in your skeletal muscle, your hypothalamus, your liver, and then the fat cells. The liver, again, is responsible, remember, for keeping that tight range of glucose so that your brain is always happy. If the liver starts to become insulin resistant, it starts to lose that ability. So your glucose starts to go all over the place, your brain's not happy, nothing's happy. And then insulin resistance also alters the formation of the proteins that we've been talking about that we need for coagulopathy, for different enzymes that are involved in metabolic functions, et cetera, et cetera. And then also the detoxification capacity of the liver becomes diminished because all of the proteins that are involved in managing toxins and getting them ready to excrete either in urine or in feces, that goes downhill. So you become more toxic. So normally your glucose levels are going to be managed by high secretion of insulin. And I don't know about you guys, but normally when you go see a doctor, they're not checking your fasting insulin levels, they're only checking your fasting glucose. Well, all the fasting glucose level is going to show you is if you're spitting out enough insulin to make up for the insulin resistance that you probably have. So a better test might be your fasting insulin in addition to your fasting glucose. Because if you're higher than, I think it's 2.4 millimolars, then you're starting to be insulin resistant. So you could have like a glucose of 80 or 90 and look perfect, but your insulin could be like 5 or 6, which means you're insulin resistant. So it's kind of a trick. I don't want you guys to go out there and just rely on your glucose levels. I would ask for fasting insulin, and then we're going to talk about some other tests that would tell you if your liver is functioning well. So again, the pancreas is just spitting out more and more insulin, and then you end up with more and more glucose oscillations, I guess. So your liver is unable to maintain a tight level. You get more of these advanced glycation end products. They deposit in your connective tissue. You start having more joint problems, muscle problems, tendon, ligament, etc. And then you have, of course, heightened chronic low-grade inflammation. You deposit more fuel in the fat cells. They start producing more of these cytokines. And again, another self-feeding cycle of inflammation from these altered glucose levels. So insulin resistance syndrome, metabolic syndrome X, you may have heard of these terms. These are all precursors to full-blown diabetes. Insulin resistance syndrome, we think, starts up to 2 decades before your fasting glucose level in your blood work is going to show it. So think about that. So we think about 50% of Americans are insulin resistant right now, even though they have normal fasting blood glucoses, and 90% of us are metabolically dysfunctional. So either your waist circumference is too big, your LDLs are out of whack, your triglycerides are out of whack, your blood pressure is too high, different things like that that are signals of metabolic dysfunction. 90% of us have this. And then when you check your fasting insulin, if you're arthritic, 82% of the people that have arthritis and other musculoskeletal problems are going to have a high fasting insulin level. Why? Because they're insulin resistant. That's why their joints are falling apart. So this is all tightly linked. You got to give your liver the proper levels of nutrition and keep it from getting scarred and keep fat from getting packed in it. Okay, you got to keep your gut healthy, you got to keep your liver healthy, or you're going to get problems like arthritis. And then along with arthritis, that's when we see higher levels of diabetes, cancer, dementia, high blood pressure, cardiac disease, heart attacks, atherosclerosis, all of that. And this is all related to higher fasting insulin levels because of insulin resistance. This is just to show you the complexity involved in the energy cycle and then the management that is needed. So you really don't want to mess with this, okay? This is a very, very amazing design that's able to fix almost any problem unless you tip it too far one way, which is what we're doing in this country with ultra-processed foods and way too much of it all the time. Sugar, added sugar and fructose, which is really way worse than sugar, honestly, if not attached to a significant amount of fiber. So we get insulin resistant from what is called technically overnutrition, which means you're eating too much, probably. And then there's increased oxidation of free fatty acids. And then higher levels of different breakdown products of the glucose cycle that then go on to become free fatty acids. You're inhibiting the enzyme production that allow the normal processing of glucose and other nutrition. Everything is just getting messed up. You're getting more hyperglycemic, so you have more advanced glycation end products. And then you're getting stiffer tissues, dysfunctional cartilage, you can't repair it at night. Your pain levels go up, your vitamin D3's gone down, we already talked about that. Your bone is weaker, we talked about that. And you have no repair and healing capacity. So now you've got higher triglycerides running around because you can't deposit the fuel, the excess nutrition, so the overnutrition has to be put somewhere. When you run out of adipose cells, when they can't get any bigger and there can't be any more, that's when the adipose starts to spit it all back out and it gets packed in the muscle, it gets packed in the liver, anywhere that it can be. You get the visceral fat that everybody talks about, which is why one of the biggest and best markers for health is your waist circumference. I think men, it should be less than 40 inches at the belly button, and women, it should be less than 35. So if you are higher than that, that means you're depositing visceral fat, which means you're insulin resistant, most likely, okay? And then of course, all of this is gonna promote things like osteoarthrosis. You're gonna have hyper levels of leptin, which is also damaging in and of itself. Leptin being the satiety hormone that normally would make you stop eating, but we become leptin resistant in overnutrition, just like we're insulin resistant. So you lose that signal that tells you to stop eating because your hypothalamus is also insulin resistant and is overinflamed.